they have a radial pulse, it's at least 80. And if they have a pedal pulse, which if you guys are wearing shoes, your pedal pulse, you can kind of see it if you take your socks off. There's a little vein right about just under the tongue of your foot, on the inside of your foot. Move yourself. Right about here, a little bit deeper. If you take you will get into the point today in the scenarios where you'll be taking people's shoes off and their socks off. And at least on me, it's a big freaking blood vessel that you can see from the top of your foot. So that's pedal pulse. If they have pedal pulse, they have a systolic of at least 100. Wilderness Medical Society has recently adopted something that we've known in the military for quite some time. These numbers aren't that accurate, but for your purposes, if they've got a pedal pulse, it's showing that their blood is at least effectively flowing. So it might not be 100, but like I said, we're looking for averages and trends. So pedal pulse is good if you detect a pedal pulse during your focused assessment, and then later you go back 15 minutes later to do your assessment again, and they don't have it, that's bad. They're getting worse. What's another way that you can tell if they've got a systolic of at least 100?
You can count it for 15 seconds and peak at 25.
No, this is much simpler. If they can stand. If you're standing up, your blood is affected by gravity, just like everything else. If your heart is not pumping to at least 100 systolic, then your heart is not pumping with enough force to move your blood to your head to fight gravity. I'm not saying if you've got an unconscious patient, you should be like, hey, can you stand up for me? Or if you've got somebody who's injured, stand up. But if you come across somebody who may be holding a wound or something, or saying that they've got chest pains and they're standing, it's at least 100. Because otherwise, if it's less than 100 and they try and stand up, they'll fall.
They'll get dizzy.
They'll get dizzy, they'll get ataxia, collapse.